A very warm greetings to everyone. The topic is about root resorption. These are the list of contents we are going to discuss on: definition, classification, etiology, clinical features, radiographic features, differential diagnosis, and treatment. Definition: external root resorption, as the name says, external, a lytic process occurring in the cementum or both cementum and dentin of the roots of the seed. Internal resorption, a condition associated with either a physiologic or pathologic process resulting in loss of dentin, cementum, or bone. A root resorption is classified broadly into internal root resorption and external root resorption. External is further classified into external surface resorption, external inflammatory root resorption, external replacement resorption, or ankylosis. Etiology: external surface root resorption, as the name says, surface, so luxation injuries to pedial, traumatic occlusion, orthodontic treatment. External inflammatory root resorption, a long-standing periradicular lesion like cyst, tumor, granuloma, or impaction, even excessive orthodontic force and intrusive luxation. External replacement root resorption, intrusion, replacement of adult tooth. Internal resorption, history of trauma, history of crown preparation, pulpotomy, the inflamed pulp. Clinical features: external surface root resorption, initially it is asymptomatic, mobility can be seen. In external inflammatory root resorption, the mobility will be increased and occasionally it can be extruded because of the inflammation. There may be presence of sinus tract. External replacement root resorption, as the name says, the root resorbed and replaced by bone gradually. They may be immobile, infraocclusion can be seen because of the replacement of the root by the bone. There may be high metallic percussion sound. Internal resorption, initially asymptomatic, a reddish area of ground pink spot is seen, which represents the granulation tissue. Radiographic features: external surface root resorption, there is no radiographic findings. An external inflammatory root resorption, in which it involves both the root and the alveolar bone, and concave ragged areas on the root surface can be seen in the blunt apex. The outline of the root canal is normal. And in the external replacement root resorption involves a root and the alveolar bone, a root resorbed and replaced by bone gradually. There is no perial space and outline of the root canal is normal. In internal resorption, it involves mainly the root canal and does not involve the bone. The outline of the root canal is distorted. These are the radiographs that depicting the above mentioned characteristics of each. Then differential diagnosis, which is very important. In external root resorption, the root canal is intact, but in case of the internal root resorption, the root canal is extensively damaged on the root surface. But in external resorption, the root surface is mainly involved. The bone adjacent to the area of resorbed is mostly involved, and the resorbed area is externally concave over here, and the resorbed area is given as a scooped out areas on the root surface. But in the internal resorption, it's only the root canal. So the root canal is enlarged, ballooning area of the root canal is seen, and there is a pink spot over there, which is also known as a pink tooth. Treatment: the external surface root resorption, no endodontic treatment is required, only the elimination of cause is needed. But in the case of the external inflammatory root resorption and external replacement root resorption, we need an endodontic treatment and surgical intervention. In internal resorption, we need an endodontic treatment. The surgical intervention: incision is done and the flap is raised, and then the resorbed area, a restoration is placed, and the sutures are made to restore the teeth back to the normal. And that's all about the root resorption. Thank you for your patience.